The fourth high-level meeting of the UN General Assembly on the Prevention and Control of Non-Communicable Diseases and the Promotion of Mental Health and Well-Being, HLM4, is set to redefine global health strategies for decades to come. This landmark event, scheduled for September 25, 2025, brings together world leaders to chart a new path toward achieving sustainable progress in tackling chronic illnesses and mental wellness by 2030. The meeting marks a pivotal decennial opportunity to create a unified, ambitious, and actionable political declaration that addresses both non-communicable diseases, NCDs, and mental health challenges globally. Building on scientific evidence and human rights frameworks, the declaration aims to accelerate global efforts to prevent, control, and treat NCDs while promoting mental well-being. However, halfway toward 2030, progress toward SDG 3.4, reducing premature mortality from NCDs by 1/3 through prevention and treatment, remains off track. Underfunding of healthcare systems has widened disparities in care access, leaving millions vulnerable to long-term health crises. Without urgent interventions, the consequences for individuals, families, and societies will be far-reaching and irreversible. The global burden of NCDs and the growing urgency of mental health initiatives are no longer confined to medical or health system concerns. HLM4 urges member states and global partners to reimagine their commitments to addressing NCDs and mental health challenges. This includes fostering cross-sectoral collaboration, rethinking health infrastructure, and implementing sustainable financing models to tackle root causes such as poverty, inequality, and environmental degradation. The meeting also calls for a holistic approach that integrates social, economic, and ecological factors into public health policies. Ahead of HLM4, the World Health Organization, WHO, invites all stakeholders, including governments, NGOs, UN agencies, citizens, and people living with chronic conditions, to unite in action. By joining forces, they can amplify local and global efforts to build an inclusive, equitable, and high-quality response to NCDs and mental health needs. The question remains, can equitable access to care alone solve the systemic challenges of health inequity? And how can we ensure that no one is left behind in this critical mission?